It is estimated that 2.8 out of 33 million are feared to be infected by the HIV/AIDS. We have more than 1.3 million orphans now, so the number is too big in our country.
We are still hiding. The HIV/AIDS will spread and many people will die. And with a Roman Catholic or as a church in general, we should teach them what is AIDS and how it is spread and what is the outcome of it. Clearly, there's no need of hiding anymore.
Our bishops immediately reacted, and so each diocese was asked to set AIDS task force, and that's how we began. And in 1985, we started the AIDS task force, and we started calling ourselves as the Uhai Center. Uhai Center, it is a Swahili name, means life.
The Society for the Propagation of the Faith assists every missionary bishop with the day-to-day operations of the diocese. Out of this support, churches and chapels are built, catechists are trained, the living expenses of the missionaries and local clergy are looked after, health services to rural areas are carried out. In many of the missionary dioceses, there are millions of refugees on the move, needing food and shelter. Emergency aid is often part of this picture. In Tanzania and throughout Africa, the epidemic of HIV/AIDS is a central concern of the missionary church.
North America has something like one doctor for every 500 or 600 people, and here one doctor for every 23,000 people. Flying Medical Service tries to fill in the gaps by covering more of the rural areas. People have seen children and adults cured. They've seen lots of diseases prevented by the vaccinations. Even in the more difficult health education issues like HIV and AIDS, there's a huge level of trust.
AIDS started in Arusha. Archdiocese was in 1986. We started counseling and the home-based care, plus education. Yeah. In 2 years, we found ourselves with a group of orphans. So we started supporting them, making sure that they get medical treatment. We make sure they go to school with their uniform and school fees.
The problem of AIDS, HIV, is killing a lot of young people. There's a lot of effort being done now to reduce this very high speed killing people, particularly young people. It is not very promising for the time being, but we don't despair. We're still working, and the church is assisting the people, particularly the young people, through its institutions, vocational training. There are a lot of other means which are being done. You have posters, radio, audio cassettes, and video cassettes, and then gathering the young people, particularly in the town, that they discuss and try to share and see what they could do. This is what we are really working on, change of behavior, because if people don't change their behavior, then I think it will not work.
Now people, they have come to talk about AIDS everywhere. The strength is that when people are actually aware of the situation, it means it's a big thing. We do teachings for the issue of HIV/AIDS and sexually transmitted diseases in various centers, schools, churches, Anywhere where we're invited, we visit those people who are no longer able to come to our office. Those who are too sick, we do visit them to give counseling, to give them medicine, to give counseling also for the caregivers.
We treat patients from everywhere. We have Muslims, we have Lutherans, and we have all types of religions, so we don't segregate them.
We get AIDS patients. Some of them, they agree to be the counseling to be done. They are anxious about it, but there are some of them who wouldn't like to be told anything. The church is important because most of the patients sometimes come to critical conditions when they really need spiritual care, so that even if they die peacefully, and we know there is eternal life. So if they go with the awareness of their religion, it's good for them.